Hello class, this is Mrs. B. I am going to go over neurological disorders as a topical overview for our medical surgical course. You have had anatomy in the past, so we will be touching briefly on those things and what the neurological system consists of in order to figure out our diseases and what is our main clinical concern here, and go through this more in depth later on, but for right now we're just going to do a topical overview. 1 in 6 of the world's population have neurological diseases, and this is according to the World Health Organization. As you can see here, I have in my infographic steps to taking through with you guys to talk about this topic, and we will proceed forward with the different types, different things we can do as nurses, and different interventions. Therefore, let's continue. The nervous system is consisted of the brainstem, the spinal cord, any neurological musculoskeletal diseases we might be covering in this section, okay? And we will also talk about the autonomic nervous system and the neuromuscular junction. So, what are these neurological disorders? There are many types listed here in section 2. I really like this picture. It's just got a nice graphic of the different spots in the brain, and it's all lit up. There will be patients with dementia, seizures, strokes, Parkinson's, Huntington's, MS, multiple sclerosis, meningitis, ALS, the list goes on. Any type of head and brain spinal cord injuries. In my research, I know that a lot of these can relate to chronic pain for a patient over time, so we'll need to talk about that as well in this clinical concern. What is our role as healthcare professionals? Number 3 here. As you can see in the picture, there's 2 nurses walking with a woman with a walker, and there are going to be many times that you will have a patient with a neuromuscular or just neurological disorder where they cannot function properly and complete their activities of daily living. That's why they are either in the hospital or receiving your home care. There are many different things we need to look for in these patients, and assessment is going to be our priority. We need to assess and recognize signs and symptoms of any neuro disorder that could be life-threatening, aka strokes. There's 2 different types of stroke, ischemic or hemorrhagic. So there's either bleeding in the brain or there's a clot in the brain, and you do not treat them both the same. So you need to really know your differences between those 2. That's going to be a main thing we'll talk about, and different assessment skills of that. So you've probably heard of the FAST exam, face, arms, speech, and time. That is a portion of it, plus we'll have to talk about the NIH scale for documenting stroke assessments as well. There's a lot involved with it, and you will encounter stroke patients, whether they've had one and they are dealing with deficits from it, which could be our lady in the picture here. She could have a left-sided weakness from a previous stroke, and she needs assistance walking to the bathroom or walking out to the kitchen to get some food cooked for her. So there's going to be tons of different things you're thinking of as the nurse, and we'll need to assess. There's been many times in the emergency department where I've went in and assessed my patient, and then I will go and see another patient and then come back in and check on them, and all of a sudden they're not speaking to me the same. They either can't speak, or they have facial drooping, or they have numbness or tingling somewhere, and that's new, and all of a sudden I become the only one that knows about it and have to do my stroke assessment. So there's going to be times where you have that. Hopefully not often, but there will be times where your patient will have a risk factor or something where you need to be thinking, is this a stroke? Could this be a stroke? Could this be a clot? Could it be a bleeding? What are the signs and symptoms I'm looking for? Interventions. You're really going to need to know as a nurse types of interventions for all these different types of diseases here. With Parkinson's, that could be just simple guiding them to walk and refocusing their mind on what they need to do. And this can be frustrating for a lot of patients. That's why I put patience here as one of our roles, is to have patience with our patients, because these diseases are frustrating for them, and they're going to be thinking one thing in their brain, and they're going to know all the right words in their brain that they want to communicate, but they either can't communicate it or they can't make their body move in the certain way that they want. So you're going to see a lot of frustration with that. You're going to need to be patient with them and teach them. The last topic is teaching, education, and resources. They're going to need to know what's the nearest hospital that, like, when do I need to call 911? Essentially is the main thing you're going to want to teach your patients if you're discharging them, or even when to hit the call button. Like, if you're talking to a family member and a patient, and you're going to talk to the family member and say, I want you to call me in if you notice their speech gets funny, or their face starts drooping on one side, or if they become increasingly weak on one side or the other. If they can't look and see you and they're having vision changes. Those are all things that are concerning and that are going to need to be, these families and patients will need to be educated on. Therefore, that brings me into how to prevent these different neurological disorders. Healthy lifestyle, major one. You want to make sure you're keeping on top of your blood pressure and your diet control, anything like that. Some of these factors up here are hereditary, so there will be potential testing that you could get done to see your risk. But on top of that, you still need to control your blood pressure, eat a healthy diet, maintain a healthy weight, and quit smoking, because that hardens our arteries and makes it difficult and more likely that you will have plaque or something that breaks off and creates a clot, and or just degenerative changes in your brain that puts you at risk for dementia. So there's lots to think about in preventing and moving forward with that. I just love this picture because it just shows kind of over time what can happen to our brains and our neurological function. And even mental health could be a big topic, but that would be a whole nother thing. But in my research, I kept coming across things that talked about mental health, and I believe, I don't know if there's research out there just yet, but I think mental health can have, your mental health is definitely affected by all of these conditions, especially if it's something that's chronic. We're going to need to know as educators and clinicians and nurses, because you're all educators when you're nurses, because you're educating your patient on the different types of things to look for and keeping these modifiable risk factors in check and really taking control of your life. Step 5 here is how to manage. Really knowing your resources is the best thing in nursing. Know who to call, who to go to, what phone number do you need to call, and anticipate what needs to happen next. I put a picture of a CAT scan here because that's the number one thing we're looking for and we're going to send the patient to if they're having neurological acute changes. We're getting them to the CT scanner. You want to make sure they're protecting their airway, but then you want to get them to the CT scanner so you can see what's going on in that brain and how to treat it. The patients oftentimes will need education and encouragement with their ADLs, as I mentioned. Parkinson's, they may have been lying down too long and they are going to take a lot longer to get up. So as the nurse, we're going to need to continue encouraging them and educating them on how to button up their shirts and how to make their food. You want to follow up with scans. You may need routine head scans or an MRI or CAT scan. You'll need to enter the community going into focused support groups because you have a new deficit and issue. So I just thank you all for listening today and hope that you have taken away something, and I'll see you in class.